Hello, everyone, and welcome back to another episode of the show with the measures announced today by the Ford government, including measures to extend winter break by an additional 2 weeks or to provide online learning for 2 weeks following winter break, reduce capacity in select settings. Joining me now to discuss all of this is Donna Skelly, who is the PC MPP for the riding of Flamborough-Glanbrook, as well as the parliamentary secretary to the Minister of Economic Development. And also joining me is John Fraser, who's the Liberal MPP for the riding of Ottawa South, as well as that party's House Leader. Let me start out with the announcement today. So Donna, I'll go to you first. Maybe you can speak a little bit about, about the fact that, children will not be returning to school. Can you speak a little bit about what was behind that decision? And actually, just before you do that, I do just want to say very quickly to those people watching at home that I did also invite an NDP MPP to join. However, no one was available. But Donna, go ahead.
Thank you, Wyatt, and thank you for inviting me on your program. I have to say that I'm very impressed by you. I spent many, many years before I got into politics in broadcasting, and you're probably one of the most professional broadcasters I've had the pleasure so far to work with. We made this decision after long discussion. Of course, it's not easy to have to shut down any part of the province, whether it's in retail space or whether it's restaurants and, of course, now schools. I understand, and I've spoken with many parents, many very frustrated parents today who recognize the importance of having our young people in school for so many reasons. It's been a tough 2 years on many of us, but mostly on our youth, our young people. And to decide to keep the schools closed for another 2 weeks was not a decision that we made lightly. But we recognize that the increase in the number of cases of Omicron simply warranted a pause so that we could prepare for an increase in the number of hospitalizations. One thing that is happening along with the increase in the number of people who are getting COVID is the fact that we are seeing a lot more people taking time off work and calling in sick. And we need to have our hospital rooms staffed. We need nurses, we need doctors, we need PSWs, we need teachers. So we made a decision to delay the beginning of school for 2 weeks so that we could attempt to halt the spread of this highly contagious variant in order to ensure that we weren't going to have a crisis in a few more weeks as the cases increase.
And I'll just follow up quickly with you, Donna. It was just last week when Dr. Kieran Moore spoke to families in Ontario and announced that school was only going to be delayed by 2 days to return on January 5th instead of January the 3rd. So can you speak a little bit about, obviously, with Omicron, cases can change very quickly, but other than some of the obvious changes with Omicron, surging, what was, some of the reasons behind changing it from the 5th to the new date now, and specifically just what's different between now and when it was announced last week that it would be on the 5th?
Well, about a week ago, we expected an increase, but we did not expect the massive numbers that we are seeing. A week ago, I knew a few people who had COVID. Today, I have family, friends, staff members who have COVID. I cannot believe how quickly it has spread and how many people have been affected by it. It's interesting because I just had a text just minutes ago from a person who is very, very ill and said that they'd been following, of course, the announcement today and was just sharing that, they never believed that this could be as horrific as it is. But it is, as I said, not only are we concerned about the number of people who are going to hospital, but we're very, very concerned about people who are also on the front line, who are working, who are having to take time off. Absenteeism rates are skyrocketing. And it's also happening with our teaching profession. So we thought if we could delay it for 2 weeks, we could guarantee that the new heightened measures that we're putting in place in our schools would actually be available, would be in place, such as N95 masks for teachers if they want them, triple ply masks for students if they want. These are all voluntary. We have, of course, improved the ventilation systems in every single school in Ontario, and we are encouraging more and more young people to get the vaccine. We lowered the age of requirement. It's now 5, and more young people are getting vaccinated. And of course, the more vaccines we get in arms, the quicker we'll be able to fight this pandemic.
And John, so Stephen Del Duca's came out, your leader, numerous times over, even just within the last week. He gave a press conference today that was prior to the announcement, where he was reacting to the decision to no longer report cases within school. So obviously, your parties came out and has been fairly vocal with the steps that, they would like to take to ensure that this didn't happen. Moving forward, though, what are some measures that, you would like to see taken? Donna mentioned that they're providing N95 masks, which is something that your party's been calling for, but speak a little bit about, I know there's lots of additional measures that you've been calling for.
Yes, there are. And we've been calling for them for some months. It's not just us, it's Ontario's doctors and nurses, educators. And so, look, I think the most important thing right now is that every parent wants to know that the child's classroom is safe. So I disagree with Donna. Not every classroom has HEPA filtration. I know in my city, our city, teachers are just getting N95 masks. They should have had them. It's not just teachers. Every child in that classroom should have access to high quality masks, and not every family can afford them. And we have to do, and I agree with Donna, we have to get everybody vaccinated that we can, because parents want to know that the person who's helping their child, a teacher or an assistant, is that they're vaccinated. And they want the other children to be vaccinated around them again as well too. So we really have to work hard at getting that done. I think one of the things that really, really surprised me was the government making the decision. Well, first of all, they said to parents, we're going to change the way that we report COVID in schools. And then they said to the school boards, stop counting COVID cases in schools, stop reporting them. And that's not right. And so I think that the thing that the government needs to do and change course on very quickly is to reverse that decision and to continue to report. Because every mom and dad and guardian of a child deserves to know exactly what's happening in their child's school and in their classroom.
Okay, Donna, so John's obviously mentioned some of the measures that he and his party would like to see taken. So obviously, the 2 weeks delaying school is something that was supported by public health experts. But one thing that public health experts did say was that, the 2 weeks doesn't necessarily mean anything if if additional measures are taken. Now, whether or not it's the measures John is calling for or not. So speak a little bit about what you'll do in the 2 week period of time to ensure that that this can happen.
Well, I want to go back to what we've already done, and that is the HEPA system that John was talking about, ventilation system, improving the ventilation system in schools across Ontario. That was undertaken over the course of the past year. Of course, the biggest thing is getting vaccines. That is by far the most important thing we can all do. And I think parents recognize that. The other thing, of course, is the distribution, access for staff members and students, staff members to the N95 masks. And of course, the improved 3-ply, triple-ply mask for students if families want them to use that particular mask. But it goes back to also, we have to make sure that there are enough teachers in the classroom, because they too are contracting COVID. And it feeds into this whole narrative of absenteeism. It's one thing to, for example, in our healthcare system, have hospital rooms, hospital beds, and a patient. But if your staff isn't there because they have contracted COVID or they're absent for another reason, then we have a serious problem. And that is also an issue in our schools. So we're taking this 2-week hiatus. Hopefully it won't last any longer. And I know it's tough. I cannot imagine, if I was a young person or a mom of someone who is your age, trying to, the past 2 years, the hybrid school system with online learning and in-class learning, and what you're, just missing your own friends. So it's not a decision that we made lightly, but it's one we felt was proactive. We often get criticized for being reactive. I believe these are proactive measures to prevent, and John's shaking his head, but I believe it is. It's to prevent a crisis in our healthcare system. We had to do it. This new variant is far more transmissible than anyone had predicted. And we knew back in the fall when we put our plan in place that two things would cause us to have to introduce stricter measures. And one was a new variant, and this one happens to be highly transmissible. And the other was pressure on our healthcare system. Both of those factors are currently in play. And that is why we've introduced the measures that we did today.
And John, I know you obviously want to weigh in, so I'll give you an opportunity. I know you were shaking your head as Donna mentioned.
Sorry. Sorry.
Do that, and then I'll ask you your question.
I'll be really quick. I'd agree that it was proactive if the science table hadn't predicted exactly the conditions that we see now on December 16th, 2 weeks or more ago. They said that this would happen, and they said you need a circuit breaker. So in this pandemic, you have to try to move with lightning speed. You can't be indecisive or slow to act, because the virus, it eats time. It runs, the slower you go, the faster it goes. And I think that's, if I had one thing that I could say about the handling of this pandemic, not just this wave, but the previous waves, and I'll exclude the first one because that was a surprise. But we should become less surprised as we go along and be able to act quickly. And you had a question. Sorry, maybe that was a bit long.
No problem. And so just as another question, so the measures that your party have been talking about, the N95 masks is something that you and the government have been able to come to an agreement with, but there's lots of measures you're calling for that you agree with and the government disagrees with. So one thing I think people want right now is for people to work collaboratively and just to have solutions and more certainty. So does your party have any solutions as to how people can work collaboratively?
Well, I think that we all want to work together, and the government has a job, and we have a job, which is to urge the government to act, and that's really important right now in this pandemic because we need to move quickly. I think that's the most important thing that the government should have taken by now as a lesson, is to be able to be decisive and act quickly, not wait a couple of weeks. This is the third time that parents have had a reversal of policy within a couple of days of school starting, and so COVID. We should be ready for the surprises that COVID gives us because we've got a lot of clues about it. So that'd be my, I think we can get there. The government just needs to get there sooner. I think mandatory vaccinations for frontline education workers, that should have been done a while ago. The government should still do that. I think we should put vaccines on the same list that other vaccines are in schools. N95 mask, high quality mask for everybody. That's something that we agree on. We've been calling it for a while. I think that's a good thing that's happening right now. Late, but good. And again, Donna and I don't disagree on this. I know that not every classroom in my riding has a HEPA filter. Not every school classroom in Ottawa has HEPA filter, and we need to have that. The federal government gave us $1 billion. We just need to get that done. I don't want to talk about it. I just want to see it get done. So there's stuff that we agree on and stuff that we disagree on. And you're exactly right. People want to see us working together. And we have to do our job, which is to ask the right questions. That's what the job of the opposition is, and that's what we'll keep on doing.
And Donna, so I want to ask you, you can respond to that if you want, but then also I want to ask you, there's lots of parents who obviously you've pointed out, and as has John, that this isn't obviously an ideal situation for no one wanted to be in the situation where we had to close schools for an additional 2 weeks. So the press release and the announcement that came out today indicated that there would be free emergency childcare for frontline workers. So obviously that's, I'm sure, welcoming news to many people. But what about those people that aren't considered frontline workers and now will have to make the difficult decision as to whether to, stay home with their kid or go to work?
It's difficult. I mean, it is very, very difficult. I'll address that, and then there are a few other things I'd like to speak to from MPP Fraser's comments earlier. But there are available paid sick days that families will have to take if they're staying home with their child over the next 2 weeks. it's just a part of an ugly pandemic. It's reality. It's become reality in our, unfortunately, in our society. A lot of people, however, are working from home. There has been a massive transition. We're encouraging as many people as possible who can work from home to work from home. And I think employers are recognizing that there are challenges with that, but there are certainly many added benefits to be able to work from from home. And then, of course, you would be able to provide some sort of childcare. It's not the ultimate situation, but at least you're in the house. But I wanted to speak to, if I may, the point about mandatory vaccines for either healthcare workers or for teachers. The problem with making it mandatory in certain professions is that we're already seeing a high number of people who are absent because of illness. And if they are fired, in Hamilton, for example, the city that I represent, one of the healthcare systems has 600 people right now absent on the absentee list. If mandatory vaccines were required, that number would be even higher. And I believe fully, wholeheartedly in the vaccine, but it does contribute to higher numbers of absenteeism. So in one sense, it does make sense, but you are also creating a secondary problem if you follow through with that. And in terms of waiting too long, we wanted and have always wanted to keep schools open, and we're criticized by both the official opposition and the Liberals for keeping kids in school. So you can't have it both ways. We didn't take this decision lightly, and we wanted to be able to keep the schools open, but the numbers just didn't play along, and they were just simply too high, and it became too risky. And so we didn't make that decision back in December because we wanted to do everything possible to keep kids in the classroom, but we just simply couldn't with the skyrocketing numbers that we're seeing today.
And John, you can respond, and then we'll go to our last round of questions.
Yeah, we should have been better prepared in the classroom. Every classroom should have had a HEPA filter. You know, every child and every teacher, everybody who worked in that school should have access to high quality mask, N95 mask. Not now, months ago. So I think we should have been better prepared. And that's kind of my point. So that if we're better prepared and we act quickly, then we don't end up in situations like we are right now. The second thing I want to say about mandatory vaccinations is the argument that it will exacerbate or make worse the staffing situation. Well, even the Minister of Long-Term Care has said, we put mandatory vaccines into long-term care because the risk to staffing due to unvaccinated workers is greater than not putting in mandatory vaccinations. So even the Ministry of Long-Term Care has said that. Mm-hmm. So that's not an argument for not doing mandatory vaccinations, with all due respect, because it does actually pose more risk not being vaccinated to staff shortages than not.
And how would you, if I may ask John, though, how would you then solve the absenteeism, higher numbers of absentee staffers? Because they are having to take a test before they go in. They are testing negative before they're allowed to work.
So rapid antigen tests are a red light and a yellow light. They're not a green light, right? They tell you if you got COVID, and then they tell you you still have to be cautious. So I think with mandatory vaccinations, if you take a look at your hospitals in Hamilton, I know a number of them have policies already, and most of their workers are vaccinated. So or all of their workers are vaccinated because they have that policy. So you're going to end up where you end up. I mean, right now we're in a situation where we have a variant, as you said, that is extremely transmissible. And that's why the government's taking some of the actions they are right now, arguably I would have said earlier, to reduce the pressure around hospitals. I think leaving unvaccinated staff in there, I know that it creates greater risks. I know that your Minister of Long-Term Care agrees with me. Look, I think the point I was trying to make about mandatory vaccinations is the government should have taken the lead on that instead of forcing every hospital and everybody to figure it out themselves. That's just my, I believe that would have been the right thing to do. I believe it's the right thing to do in education. I think every parent wants to know that the person who's caring for their son or daughter, that person's been vaccinated. I think it's a reasonable thing. And so, Donna, none of this stuff is easy. And I'm not trying to say that it's easy. And, but my viewpoint is that you have to be decisive, act quickly, and act with strength. And that's why I believe mandatory vaccinations were really the purview of the government, and not to leave it up to every organization. We could have done it much faster, much more directly, and been in a better position. I know I'm holding up Wyatt on his second or last round of questions there too, so I'll zip it.
No worries. And so just Donna, and then John, maybe Donna, speak a little bit about, like, there's obviously, we've been talking a lot about schools on our panel today, but maybe you can speak a little bit too about small businesses, because obviously there's many of them, like, obviously we've been in this situation before where they've had to open their doors and then close them again. But what can you do? I mean, the Premier announced, I believe, some measures today for small businesses, but what can you do to make sure that this is the last time that small businesses will have to close again? And if it's, I'll speak a little bit to where I'm from. There's lots of, I live in a fairly small community, and there's lots of businesses in my riding who are, just starting up, who started during the pandemic, or those who have been here for over, let's say, 30 years and are nervous about having to close their doors. And I think that's the concern of a lot of businesses. So speak a little bit about how we can ensure that we can move forward, not backwards, as we move forward in the pandemic.
Well, a healthy population is as important as a healthy economy. And we recognize that this pandemic has taken its toll on small business, on large business, on not just financially, but mentally. When the pandemic first broke almost 2 years ago now, I mean, I recall conversations with people who had family businesses that were in tears because it was, Mother's Day, and it was their primary selling season, and they were having to shut down, and it was gut-wrenching. It really was. We introduced, and I know John will probably want to criticize it, but we introduced grants for small business. And many businesses took advantage of that. Almost $1 billion was issued in funding for small businesses. Recently, we introduced grants to help cover the cost of taxes and also rebates on hydro. So we're doing what we can, and that would be retroactive to December. We're doing what we can. The problem is there's no guarantee that we may not have to take other provisions down the road. The best thing we can do is to encourage everyone to get vaccinated. John's talking about it, but we have to encourage people to get vaccinated. We have dropped the age requirement to 5. We have shortened the length of time between vaccines. We've introduced a 3rd booster and now a 4th for those who are most vulnerable. That is probably the only true measure that we can implement to guarantee any sort of end to this pandemic.
And John, I'll just give the final word to you on the same topic about ensuring that we can move forward, not backwards.
Well, Donna says I may have something to say about it. Look, I'm not going to look in the rearview mirror and talk about the money that went out the door that shouldn't have gone out the door. I do disagree that the government's not trying to get some of that back to people who really weren't entitled to that money in the first place. Look, the rebates for hydro and on the taxes for being closed for a certain period of time, I'm not going to say that's not a good thing. I don't think that will be enough. I think the government will have to do more than delaying people paying their taxes. And so I want to see, we don't have the exact details about how people can apply for the first program. Today, the Premier said there'll be more programs. I'm interested in seeing what they are. And the government's going to have to do more. But here's the other piece, is that if we want to help small businesses, if we want to help schools, then it's kind of up to all of us in some ways as well, too, which is to, try to patronize your local businesses. It's not going to work for everybody, but do your best to go to those shops or to order from those shops. And I think that's a really big thing. And the other thing is wear a mask, get vaccinated, get boosted, follow public health orders. Those are all things. And I know it doesn't look like that's going to change everything, but if people follow those things, it's going to help to get us out of it faster. So, we all, we can all talk about, there are things I want the government to do. but there's also things that I have to do as an individual, just as Donna does, as anybody does, that's going to help small businesses. Let's patronize them, and let's make sure that we follow the public health orders and do the best we can to get our community healthy again. And I think that will, that's what I'd like to leave it on, because I think that's a really important message.
All right. Well, Donna and John, thank you so much for joining me today. And it's been great chatting with you, and look forward to hopefully having the both of you back on in the coming months.
My pleasure. Happy New Year, and stay safe.
Thank you.